leadership and influence. So let us venture into AI for a while. The idea of the talk basically where can exactly we place AI in AMS and infection control. This would be the outline of my talk. What is the technology behind the AI? And what is the practical applicability in the antimicrobial stewardship and infection control? What are the ethics and safety concerns? What are the biases involved when we use AI? And do we really need to fear AI? So let us just go to the basics. In the biological neuron, so whenever we have certain input, it's being processed in the neuronal cell body, and the output is delivered through the axon terminal. But then coming to the AI actually designed to mimic the biological neuron. AI per se is a mathematical construct which is the fundamental building block of the artificial intelligence. See the number of inputs that the artificial neuron, that the AI would receive it, and the output which it delivers. Coming to the development of AI, it broadly has three phases. One, training the AI. Second, validating the AI. And definitely once the validation is being done, so what is our experience, practical experience when we use this AI in a clinical practice? So the idea of AI is basically it's a machine. Of course, it's a machine. So it uses approaches such as deep learning with neuronal networks. So basically, what AI does is when we when we give a bunch of data to the AI, it recognizes certain patterns and then makes certain decisions or predictions based on the large amount of data. That's how the AI works. So, and even the AI is effective for tasks like image recognition and even natural language processing. So the other common terms where we use this AI is machine learning, deep learning, natural language processing, are the artificial intelligence. So if we see the published literature in AI, we have a bunch of data in which AI and infectious diseases. But coming to the AI and infection prevention and control and the antimicrobial stewardship, the data is really sparse. We hardly have less than 10 to 15 articles in AI and the antimicrobial stewardship. So broadly, we can use AI in our clinical practice basically in three ventures. The number one venture is we can use AI as a clinical decision making tool. Like let's say in a practical way, you can use AI to calculate, like it can be used as a dosing calculator. Number one, you can use AI for the allergy check, drug interaction check, and even for the automatic catheter removal alert. Number of times we often forget for the removal of the catheter, you can use actually AI to set an automatical alert. So the second venture where you can clinically use AI is in the deep learning. So let's say if there is a certain drug mismatch, AI will automatically identify with the mismatch and it will automatically give you an alert. Number two is a positive blood culture alert. We all know that there is a good amount of time where the blood culture flags in the microbiology lab, and the clinician get to know that the blood culture has been flagged. So AI, when you incorporate AI into the microbiological lab per se, it will automatically send an alert to the clinician that so patient's blood culture has been flagged. The third, again the MDRO flag. Whenever an MDRO is flagged in the microbiology lab, AI will automatically send an alert so that you can initiate the contact precautions first, the isolation precautions first. So the third area where the AI is being used currently is the generative AI. So generative AI itself is using the AI in more of a research and analytical way. So let's say if you have a whole bunch of articles and if you just ask the AI or ChatGPT that can you give a summary of whole of these articles, so AI will just give you a pure nice summary of these articles. Number two, it can give you a graphical or a nice pictorial representation. Third, you can use AI to edit the manuscript per se, and finally you can use AI to delete the for the duplication of data, identify the duplication of data as well. So just the practical applications of AI and antimicrobial stewardship, you can use AI for the antimicrobial stewardship GPT. You can use the AI to summarize the long documents and articles and keep it as short as possible. The third is to translate. You can use AI as a barrier, especially the linguistic barrier. You can use AI to translate it and simplify for yourself. Or whenever you're using this education program, this AI will generate the automatic. It will generate the quizzes from the existing components, and finally it is used a lot in research and events to check the manipulative data. So coming to the first one, use of AI in infection prevention and healthcare epidemiology. So AI can we can use AI to improve the hand hygiene compliance by integrating the machine learning. We all know that hand hygiene can be improved in the ward basically by repeatedly educating the healthcare workers. But by using AI, you can generate some integrated machine learning algorithm and even video processing that will improve your hand hygiene compliance per se. Second, you can use AI to detect the HAIs as early as possible, and you can give a good feedback to the healthcare professional to improve the infection prevention control and practices. Third, when you integrate AI with your electronic health record, AI per se can detect what individuals are at risk of this SSI. So certainly you would have more surveillance and more watch on the pre-surgical antibiotic prophylaxis in these patients, and you can decrease the SSI rates in them. So let's see, this was a question I was asking AI, that the chat GPT. So what additional value that the contact precautions would add to the standard precautions when there is an MRSA infection in your hospital. So PCA has given a nice 4-paragraph good textbook kind of description that what are contact precautions and what does contact precautions, how does it help in the practice. But although if you see the last line, this ChatGPT didn't actually acknowledge the controversies, the subtleties and the nuances which are involved in the clinically when we apply this contact precaution. Certainly, AI will improve the workflows for the infection prevention, mainly to analyze the data and minimizing the countless hours which are spent in analyzing this data. The other important role of AI is whenever there is an outbreak or there are certain early triggers in terms of outbreak, AI can identify such patterns and it can throw an alert that there is a possibility of outbreak in so and so setting as well. Even the current CDC is using a surveillance system which is automatically integrated with the AI, and that can pick up the outbreak as early as possible. So the second thing, the utility of AI in the antimicrobial stewardship. So we all know when we are using the antimicrobial stewardship program in the hospital, we give an individualized or the recommendations to the primary physician that so and so antibiotic has to be administered at appropriate dose. But if you incorporate AI and the antimicrobial stewardship, it will give you an individualized recommendation with an appropriate antibiotic selection, dosing and even duration as well. The other new venture where AI can be used is in the microbiology lab per se. So AI can be used because we have a lot of new molecular technologies in the field of infectious diseases. So this AI can be used to actually validate the newer technique, to check the reliability of this test in the lab before implementing into the clinical practice. So let's say this is a prescription this is the ATT of the patient. So if this is uploaded automatically into the AI, if this is the third box, AI is automatically is saying that your dose of isoniazid is around 600 milligram per day. You need to decrease the dose and so that to reduce the complications. That's where if you integrate AI into the antimicrobial, into your EMR and the prescription, so that this will automatically flag you an alert aspect. So finally, with all the four with performances, it is clear that human oversight, human expertise and direct communication is still required, at least for now, although we have a lot of applications with the AI aspect. So the other utility of AI in the public health, we have a lot of data to analysis aspects. So if we incorporate AI in this, it will actually cut down a significant amount of time in analyzing the data and give you the overall summary aspect. So again, as I was saying, CDC uses AI for its syndromic surveillance system, which collects and analyzes the emergency department data in real time to detect the potential outbreak. So it can, in fact, CDC has used this AI as per its syndromic surveillance system during COVID outbreak, influenza, and even RSV as well. So it is capable of detecting certain triggers or certain patterns which are specific to these outbreaks, and it can throw you an alert at. So coming to the ethics and safety concerns, we all know in the field of medicine, anything do no harm to the patient. That is, the safety of the patient is first rather than any other advantage. So we need to really look forward to these ethics and safety concerns when we try and incorporate AI into the clinical practice. So the other thing is the data privacy, because by using AI in your clinical practice, you need to provide this whole patient data and you need to incorporate your EHR into the AI. So, but we all know that this patient data has to be at most confidential coming to the patient data. So we need to be really careful when we are using AI and when we are integrating AI into the EMR process. What are the future directions and the warnings that the AI would give you? You can use AI for the greater automation, that it can improve your workflows and it can decrease your workflows and decrease the time spent in analyzing the data. Number two, it can operate in multiple languages. It can serve as a tool to bridge the linguistic gap and promote the global collaboration. So in conclusion, AI is gonna stay with us and it will expand no matter whatever, because it's a technology. It will stay with us and it continues to expand. But we need to proactively explore that where should we place AI in our healthcare system. We need to proactively explore and integrate with us at the best level and develop a framework for appreciating its benefits and limitations per se. So despite these benefits, we must recognize that AI currently lacks originality, AI lacks thoughtfulness, nuances, innovation, and even ability for it to function in the grace. So we all know in the field of medicine, human touch remains essential to uphold the passion and humanity of medicine. So this is my last slide. So this is a good article by David Brooks in New York Times. So do we really need to fear AI? Many people really fear AI, but if you read the article, it is clear that we shouldn't fear AI. So we should see AI as an ally, but not as a rival to us. You can use it to transform the education, handle the Odaya stock. These are overall productivity. Yeah. Thank you. Now, what is it that take the help of AI? That's what said now or started AI, the radiologist there, most of my radiologists have developed over now. What I use it, but now we make not of AI. So now,